I'm Dr. Jagadeesh, PC, a senior consultant orthopedic surgeon, practicing orthopedics, general orthopedics, and trauma, arthroscopy, and replacements, which includes the knee replacement, shoulder replacement, as well as the hip replacement, and specialized in arthroscopy and sports medicine. After the knee replacement, we will extend for some degrees only, but of course cannot able to bend completely, because any replacement, any metal, it has got its life. So putting the knee under totally the replaced knee under too much of stress, it's not a good advisable. They can sit crossed leg, over a bed or some time occasionally, but kneeling full completely down and all, there are few things like high flex knee which is available, we do it, but we tend to always put a precaution, like occasionally they can do a completely knee bending or kneeling it rather than doing it daily as a routine procedure.